Hi, I am Dr. Chava Anjaneyulu, Senior ENT Specialist. I am working with Apollo Hospital, Jubilee Hills, Hyderabad. Some patients will come with the problem of the nasal obstruction. Nasal obstruction is the commonest symptom and problem. Many patients, nasal obstruction is mainly due to the deviated nasal septum. Whenever there is a deviated nasal septum, opposite side automatically turbinate hypertrophy will be there. So deviated nasal septum, inferior turbinate hypertrophy is the both most of the times a patient will have problem. Deviated nasal septum may be due to trauma or may be due to with growth. If there is any minimal deviation in the childhood, with age it will increase. Same if any injury to the nose, it may also cause the deviated nasal septum. Mainly with the deviated nasal septum, patient will have the problem of the nasal obstruction, breathing difficulty, snoring sometimes, and sleep disturbance also. Because of the nasal obstruction, patient may have more chances of the sinusitis problem also. Because of the blocked deviated nasal septum, there may be secretions stagnation that will cause the second infection, lead to the chronic sinusitis. This turbinate hypertrophy and deviated nasal septum both together will cause the chronic sinusitis problem. So if you have nasal obstruction, at this time, if you can correct the deviated nasal septum, patient may not have other issues. He may not have any other sinusitis problem also. So early detection and early treatment is very important to rectify the deviated nasal septum, to improve the symptoms, and to prevent further complications like sinusitis. Deviated nasal septum we can diagnose easily by the nasal endoscopic evaluation. In nasal endoscopy, we can diagnose very easily deviated nasal septum, turbinate hypertrophy, if any other associated pathology also we can diagnose very early. And if the patient has any other symptoms like nasal discharge, facial pain, always get the CT scan of the PNS. Because many patients with DNS, they may have associated sinusitis problem also. For deviated nasal septum, the main treatment is the surgery, that is correction of the nasal septum, that is septoplasty. It is very good surgery and results are excellent. There is no recurrence. Many patients may ask, after surgery, this comes again? No, it never comes. Deviated nasal septum never come back. Once you correct, it will stay there. It will be corrected. It will be in the straight position. Along with the deviated nasal septal correction, if there is any turbinate hypertrophy, you correct that turbinate hypertrophy also. With the deviated nasal septal surgery and turbinoplasty, patient will have complete cure from the nasal obstruction. Patient feel very happy. Airway will improve like a lot, and recurrent cold problems also will come down. So if you have any deviated nasal septal problem, contact me at Apollo Hospital, Jubilee Hills in Hyderabad.